At this time, I have the pleasure of introducing Dr. Amed Awan, Professor and Associate Vice Chair of Education at the University of Maryland School of Medicine. He obtained his MPH at the Harvard T.H. Chan School of Public Health, and he is a frequent contributor to Forbes and has a YouTube channel entitled Med Ed Page, where he publishes regular videos on public health, medicine, and radiology. He will present on misinformation, how to combat it, and its impact on public health. Dr. Awan, I turn the floor over to you. Thank you.
Okay, thank you so much, Kevin. And thank you very much for having me. It's a real honor to do this. Great to meet many of you as well. And a little bit about myself. So, as Kevin said, I'm a physician. I'm a radiologist. I'm a diagnostic radiologist. So I read, and I specialize in the musculoskeletal system. So I read CT scans, MRIs, X-rays for a living. I do image-guided procedures. I do biopsies of soft tissue tumors, but I have a profound love for public health. I spend a lot of my time talking about public health, writing about public health. So very honored to do this. So I'm going to talk about medical misinformation and how to combat it. And this could not be more relevant given the end of the public health emergency for COVID-19 this past Thursday. And I think it's something that we should learn from. We should really learn from what medical misinformation is and how we can prevent this in the future, because there definitely will be future epidemics. There will be future pandemics. So it behooves all of us to learn about what this is and how we can rectify this sort of moving forward. My objectives are really threefold. I want to just discuss common medical misinformation that's been propagated in recent times, just to give you guys an example of what this looks like. Hopefully we'll elucidate different causes of medical misinformation and then outline ways in which we can combat this medical misinformation so that we don't make the same mistakes that we've made in the last 3 years with the pandemic. So these are just myths. I'm about to share some myths that I'm sure many of you have heard. And in fact, if you Google medical misinformation or, myths, these will likely come up. So this is: the US government is hiding vaccine side effects from the public. I'm sure many people have heard this myth. Myth number 2, berries are more effective than vaccines in fighting infection. So believe it or not, this was another myth that was propagated throughout the internet and another example of misinformation. Ginger is more effective than chemotherapy in treating cancer. That's myth number 3. And the fourth and final myth is, and this is very alarming, this last one, it really gives me chills. COVID vaccines cause harm and death to children and pregnant females. And you can imagine, if people start to believe this, especially number 4, that's going to cause a major problem. And it did cause a major problem for us in the United States and probably worldwide. So these are well-known myths. You can Google these, propagated in recent years. So can be very alarming from a public health standpoint when we're trying to propagate good and useful information that the public can use to further enhance their health. This will do the exact opposite of that. But then the question becomes, well, is medical misinformation new? Did this just start during COVID-19? And the answer is absolutely not. Medical misinformation has been present for centuries, even dating back to the mid-1700s. And I'm not saying this is the first example, but this is just an example of medical misinformation. In the UK, in Britain, during the Jacobite Rebellion, King George II was the leader then. And, there were printing companies that were distributing the fact that he was ill. And this was politically motivated. This was to draw confusion amongst the masses to weaken the British Empire. So it happens, it occurs. And there are many different motivations for misinformation, but this is a real reality that has been present for a very long time, but certainly was amplified during the COVID pandemic from 2020. So I think it's also important just to pause and think about, well, what exactly is misinformation? What do we mean when we say misinformation? And actually, I want to open this, and you can unmute yourself if you want to. I would love to hear someone unmute themselves and tell what they think is the difference between misinformation and disinformation, and which one you think is worse.
So this is Matthias from Singapore. I think this implies intention, whereas mis not necessarily implies intention.
That's right. That's exactly right. Yeah. So disinformation would be worse, right? Misinformation is just when you have information is just false. it's inaccurate, it's misleading, according to the best available evidence that we have, right? So, some of these myths that we're talking about. But disinformation really is a little bit more sinister, right? It's exactly like you said. It implies that you have a malicious intent, meaning that you're using the misinformation for some gain, either some political gain or some financial incentive. There's a motive associated with that misinformation that you're trying to trick others. So disinformation is for sure worse than misinformation. And both exist and both are very alive and well. But, this talk is really going to be talking about medical misinformation, just information that is completely false, completely inaccurate based on evidence-based data that we have. And I think it also behooves us to ask, well, how does this spread? How is it that misinformation spreads? Well, it's actually very easy, especially in the times that we live in. If you take a step back and think how easy it is, it's very easy to propagate things that aren't true and to have people believe them. And one of the major reasons is social media. And I'm on social media. I'm on Instagram. You can see my Instagram handles right here. You can see my Twitter handle right here. I'm on YouTube. This is my YouTube channel, Amed page. But with that said, social media can be a great force, but it can also equally be a force that propagates misinformation. And the reason for that is that these media is not peer reviewed. Anyone, a child, can go and start posting things on social media, on Twitter or Instagram or Facebook, and it's not being reviewed by any major body or local authority as to whether it's true or false. So you can have people who have no evidence whatsoever that are posting things and it's completely false, right? And then it gets propagated, and social media is nothing like it was before. Social media didn't exist 50 years ago. So just the opportunity for information to spread vastly, globally, is unprecedented. This allows for misinformation to happen as well. So there are many social media platforms, Facebook, LinkedIn, Instagram, Twitter. These are just some of them. Mastodon. There's so many. We can talk Pinterest. There are very many ways that people can disseminate information, whether it's true or false. And this is alarming because we take a look at data from Data Reportal. This is data on the average amount of time that people spend on social media daily. And if you take a look, this is dating back from 2019, so before the pandemic, and then towards the end of 2022, the end of last year, pretty much people are spending on average 2.5 hours. And this has been pretty constant, right? So before and after the pandemic, 2.5 hours on social media. So that's a lot of time, right? That's 1/12 of the day, maybe 1/11 of the day, right? A significant amount of time on social media platforms. And they can read anything. They can literally read anything on there. And in America, I know there are people here from Singapore and some other countries, but more than 70% of Americans are using social media daily. And if you take a look here from 2008, we have less than 20%. And now going past 2020, more than 70% of Americans are using this on a daily basis. And this is according to the Pew Research Center. So it definitely has important implications for medical information, medical misinformation, and it's just so widely available and it's just so ubiquitous in society, which makes this very challenging for us. And the way this spreads is through something called circular reporting. So you can have someone saying something that, yes, berries are more efficacious than vaccines. Someone says that, and then it gets picked up on the internet, it gets tweeted, and then someone from the press who's writing an article quotes that, and then a news channel will report that, and you can see that this circuitous reporting of it just being amplified and propagated becomes a problem because someone did it to begin with. They may have cited some very weak evidence or evidence that's not even factually correct, and then you can see that more and more people are circulating it, and it just becomes a problem, and it can eventually go viral, and then it can become a huge problem because then people start to believe it because they see evidence that may not even be true associated with it. And then people start to believe it and they implement and they act upon that. And you can see how that can be a public catastrophe from a public health standpoint, right? So this circular reporting is one of the major reasons why medical misinformation can exist and why it exists. And why is it even out there? Like, what's the reason for misinformation? This is an article that actually Kevin shared with me. The headline on the Washington Post was Russians boasted that just 1% of fake social profiles are caught, leak show. So there are certainly political influence, just like we talked about, in Britain in the 1700s. There are political motives for misinformation. And we saw that in our COVID-19 pandemic, the politicization of wearing masks or the politicization of the vaccines, right? And how it was linked to and parties' interests. So there are political motives for disseminating misinformation, unfortunately. And that's what we saw in the COVID-19 pandemic as well. So, this is very troubling that, just 1% of fake social profiles are caught, which means 99% are not. So that begs us the question, well, what are we doing about those other 99% of profiles that aren't being caught, that are, continuously propagating information that's not valid and authentic? And another major reason as to why this occurs is actually just the structure of social media itself. So I'm not sure how many people here are proficient in social media in the way Twitter works or Instagram works, but just the actual structure of the way it works actually allows for misinformation to be propagated. And the reason why that occurs is because people start to tweet things. And for example, let's say you're using Twitter. The more you start to like a tweet or you retweet it, it becomes present. More and more people start to see it. It becomes prevalent on the top of someone's feed, and then people get more exposed to it. That allows it to spread and go viral and propagate and disseminate very broadly. So, social media reward system and this infrastructure is a perfect storm for misinformation to occur. And, this was talked about in this article here from USC, from Wendy Wood. So very powerful and very problematic from a public health standpoint if knowledge or facts that aren't true get propagated. So, and the financial incentives with that too. Those who are making money off of their tweets, they start to get more and more money, right? When these start to go viral and more people interact with them. So very problematic from many perspectives. Another major reason is lack of media literacy. We go to school to learn, what's the purpose of grade school? The purpose of grade school, one of the major ones is that to learn critical and analytical skills, to be able to dissect information and to critically evaluate information, to figure out, well, what is good about this? What is bad about this? What are the different views and perspectives about this? What are the motivations for some of these views? How can this be applied and implemented in daily life? Well, based on this, recent survey from Education Week, nearly half of adults aged 19 to 81, so it covers all of us who are on this Zoom call, did not learn media literacy in high school. So nearly half of people did not learn this skill about looking at information, critically analyzing it. And that's a problem because then they won't be able to dissect misinformation when they see it, right? They won't be able to dissect it. So it's going to be a problem. These are some of the major reasons why we have this medical misinformation in society, and certainly in America, where it was very prevalent. And I think this is a very important point. This lack of media literacy, this lack of healthcare literacy is very much a reality in America. And many people don't have the capacity or the skills to be able to do this, this has become a problem. And this was amplified during the COVID-19 pandemic. So moving from that, well, how do we combat medical misinformation? And this was actually an article I actually wrote. I actually wrote this in Forbes. So I'm a public health contributor for Forbes.com. I write almost on a weekly basis, try to write 4 articles a month. And this was an article I wrote, I think last month or the month before. And I talked about, and I would love for everyone to read this, health misinformation and how to curb it. Now that we have medical misinformation, well, how is it that we combat it? How do we allow it to go extinct? That's the topic that I really wanted to combat in this article here that I wrote for Forbes. I really came up with 4 different strategies, and you can read about it in my article if you want to get a little bit more detail into the nuances of it. But really, I talked about 4 strategies. One was having clear messaging, and I want to go into all these. The second is having public health experts lead the narrative in terms of disseminating this information. The third is, as we talked about, holding social media platforms accountable when, in fact, there is misinformation. And then finally, increasing this health and media literacy that's lacking, especially in America, where nearly half of adult-aged individuals don't have this health and media literacy. When we talk about clear messaging, there is a clear crystal example of this. So if we look at the COVID bivalent booster that's been available here in America, 20% of people have heard nothing about this. This is a vaccine. This is supposed to save lives and prevent death and severe illnesses from COVID-19. And yet 20% of adults have heard nothing about this based on this Kaiser Family Foundation. The rate of uptake was very low. Like even now, based on current CDC trackers, only about a little bit over 60% of people who are eligible to get this vaccine have gotten the bivalent vaccine. So it should not surprise us that the rate is so low, given the fact that a high percentage of patients have no idea that this even exists. Now, there are other reasons for the low uptake, like COVID fatigue. I understand that. COVID fatigue and people thinking that getting 2 sets of vaccines is sufficient. They don't need to get this bivalent. There are side effects. I get all that. But the reality is that a fifth of the population doesn't even know that this exists. So this is where clear messaging really could do wonders. And this is the data tracking. Only 16.8% of the population that's supposed to have gotten it have gotten this bivalent vaccine. Public health experts should also lead the narrative when it comes to public health topics. And this is done to some extent, but it's not completely. For example, if you need advice on a cavity in your teeth, who are you going to go to? Are you going to go to me? I hope you don't go to me. I hope you go to a dentist, right? You're going to go to an expert that knows everything about teeth, cavities, and how that can be treated, right? That's common sense. I mean, everyone, all 13 people on this Zoom chat would agree with that. So why don't we turn to public health experts when it comes to critical matters that affect our life, like literally our survival, right? We go online, we trust people that have no knowledge about public health on social media. We read about things that are not well substantiated, articles. We go to all these different sources, but we don't go to the experts that live and breathe this stuff on a daily basis. So I think that's also a problem. We all have our own opinions about what happens and what occurs, but really we should rely on those who have studied these diseases and these vaccines intensively so that they're able to give us the best information based on the evidence that is most relevant during the time. So news outlets, media, all of these should honor these people and should bring them on as much as possible to educate the public. This means holding town hall meetings, community hall meetings, federal press conferences, coming to the White House to speak on these kind of topics. So all these things, news media outlets, very important for the public health experts to lead this narrative when it comes to evidence that's going to affect millions of people and save literally millions of lives. There is a lot at stake when it comes to these public health measures. I think it's also important to keep social media honest, right? Take a look at this research from the Pew Research Center. Nearly half of Americans get their news on social media. In 2020, it was a little bit more than half. And now, from 2021, it was a little bit less than half. But that means that the majority or a near majority of Americans are getting their news, not just on, turning on the TV and listening to CBS or ABC, but they're actually getting it from like Facebook, Twitter, Instagram. I mean, this is the reality. This is what the research shows. And, this can be good because it allows for you to get your news at any time, but it's also problematic because you can read things that are posted by anyone who has no knowledge and no background on the material, right? So again, it's a double-edged sword and it can be problematic, but this is the reality. This is what's occurring based on the data. So we must monitor social media posts and content regularly. They need to be held accountable for any misinformation that's being posted. And the way we do that is that we amplify, and to correct this, we amplify evidence-based knowledge on public health issues. So people who are in charge of running Twitter, Instagram, YouTube, these media outlets, amplify evidence-based knowledge, right? So that more and more people can see what the best evidence is out there to protect society, to protect individuals. Weaken those financial incentives on accounts that are spreading misinformation. Don't allow them to get money just because a tweet is going viral or something like that. Mandate the use of real name accounts. A lot of these are bots, accounts that aren't even real, but then they start to just retweet things. But make sure there's a real person behind each account. And I think using artificial intelligence can help in this respect. Using machine learning algorithms to remove unsubstantiated information can really help. ChatGPT can do so much. There are many algorithms that are being developed to help streamline this process. This is a great use of artificial intelligence in the future to allow social media to be honest. And then finally, increasing health and media literacy, right? Kind of talked about this already, but it's worth saying that what's really the purpose of our education in grade school? If we live to our 30s, 40s, 50s, 60s, and we can't decipher or critically analyze whether something is effective or the sources are credible, or is this point or information backed by evidence that's actually valid and accurate, then have we not gotten a disservice from the education that we received? So all these education programs should bolster this type of knowledge, this type of training in grade school so that people have the ability to decipher correct information from false information, right? So learning these skills is very key. Deciphering the credibility of sources, understanding biases. Everything has a bias. I have a bias. I have a bias coming in to giving this talk. When you listen to CNN, Fox, they have different biases, right? They have different agendas when they're delivering information. So having the insight to understand, well, what biases exist and how do we evaluate that? How do we evaluate the information? Because there is a bias, right? Nothing is perfect. We're all human beings, and we all bring some element of bias in the way we report and in the way we talk about certain topics. And again, I just want to show this article from Education Week where nearly half of adult age individuals did not learn media literacy in high school. And I think that's a very telling statistic in terms of our ability to interact with misinformation and what we do going forward. So very troubling and something to think about and food for thought. So the question is, well, what are the consequences of this misinformation? Well, we know that more than 1.1 million individuals in America alone died from COVID-19. The numbers are much bigger, obviously, in the globe. But if we take a look at it, this chart, I think, is very telling. And this is from the Brown School of Public Health. There were 641,000 actual deaths. That's how many deaths there were, right? Based on this survey here. But the estimated deaths, if 100% of people were vaccinated, there would be 322,000 deaths. So more than 300,000 deaths could have been prevented from the vaccine. If 100% of the population in America took the vaccine, more than 300,000 deaths would have been prevented. I mean, that could have been one of your loved ones. You know what I mean? Honestly, this is a big deal. This is a big deal. We had a decent percentage of people vaccinated, but it could have been better, right? It should have been 100%. And misinformation is a major reason for people not doing it, right? Hearing about different side effects or believing that certain side effects exist, the politicization of vaccines, all these things, the mistrust that's occurred in the public, all these things could have had a major effect on people and preventing vaccines. So I'm going to end by just saying that it takes a village. Public health and ensuring everyone gets the best health is all of our responsibilities. It's my responsibility. It's your responsibility. So thank you. I'm deeply honored to be here to talk a little bit about medical misinformation. Hopefully this opens some eyes and some food for thought for all of you. This is my email if anyone wants to email me, omer.awan@umm.edu. I would ask all of you please to subscribe to my YouTube channel, the MedEd page, MEDEDPAGE. There's tons of videos on public health and many other things in medical education. Would love the support. Follow me on Twitter @AwanRad. And thank you so much for your attention. I'm happy to take any questions at this time.